I was in the ICU because I had sepsis, and it all started from a routine surgery for endometriosis. I went home the same day that I had the surgery. I was told by the surgeon to expect pain of varying degrees and what the warning signs would be to look out for. Um, it was my first surgery, so I, of course, didn't know what was normal in terms of pain, any sort of bodily feeling, but they did give me a pretty thorough checklist, mainly for looking out for a local infection in the incision sites. By, I would say, the second or third day, my pain was so immense. And at that point, I was thinking that I've always had a very high pain tolerance that, again, is this the norm, or is this one of these warning signs that's not written on the piece of paper but could be something else to look out for? So the surgeon said to me um, to, or instructed me to take my temperature. I did. It was, I think, somewhere around 34, 35 degrees Celsius. And his reaction was that there's something wrong with the temperature monitor. So I bought another one and I did it again and again, and it kept showing up like this. He advised me to just take more painkillers and to sort of see how things would go. And then the next day, I woke up and I couldn't stand up. The pain had gotten to the level where I felt like I was barely conscious. Um, so I essentially had to be carried to A&E, and within 1 hour or so of being admitted there, I was told that, and after a lot of tests and many doctors and surgeons hovering over me, um, they told me that I had an incredibly large infection in my stomach that had also spread to my sides and into my bloodstream. So I was diagnosed with sepsis. And they also told me very directly that I was lucky to be alive. If I hadn't come in right at that moment, and again, this is their words, they said that I could have died later that day. So I was then carted off to what the surgeons called life-saving surgery. And from there, I mean, horrible ordeal is a more subtle or nicer way of putting it, but that's when really just a horrible ordeal started. They were able to contain the worst of the infection, and I woke up in the ICU, I think about a day later, and it was shocking. I spent about 1 week in that ICU in a critical state. I was cordoned off into sort of my own area, or sort of a room, um, which I later learned is created for patients who are at high risk for infections. Um, and then when my, they called it an infection rate, and my vitals were more stable, I was moved to a specialist hospital where they treated cases like mine. and I was there for about a bit over a month, and I had 3 more surgeries and a lot of other procedures. When the day came for me to go home, I was so happy. I couldn't stop crying. Um, and those first couple of days at home were incredible emotionally. I mean, physically, I was still experiencing quite a lot of pain because the infection had spread. Was at home. I was still physically healing. I was very happy. And then after a few days, I definitely started to experience some anxiety, um, because the previous time I was discharged from a hospital after surgery, I got sepsis. So every little change or new sort of pang of pain immediately brought me back to the start of that journey. Um, but I I'm really happy that while I was still in the hospital, what helped with that anxiety was that while I was still in the hospital, they offered psychiatric help to patients undergoing very severe medical crises. And I started seeing or talking to a psychiatrist while I was in the hospital. And I decided to continue that immediately when I got home. So it helped immensely when returning. Um, I think a lot of people think that you get home from the hospital, you're all good, it's over. Um, but the physical recovery, it takes so long, it's not over. Um, but again, I'm really happy that I sought psychological help from the beginning and started therapy at the start because it helped with that transition stage a lot. And that anxiety went away pretty quickly. I strongly believe that this was completely preventable, what happened to me. And I just want other people to know who um, are going through surgery to know that they should advocate for themselves, especially as a woman. Um, and there's abundant research that shows that women are misdiagnosed or offered treatment, improper treatment, far more often than men. I just want others to know to really listen to their own body and to support themselves, advocate for themselves if they truly feel like this is not normal, this is too much pain. Um, Even if your surgeon, your doctor, but whatever healthcare professional is telling you that everyone's unique, just take more pain medication to push past that and really seek that support. Because if I hadn't waited for those 4 days, who knows what my outcome could have been. Mhm. With endometriosis pain, because that's something that I'd had for years, I had become pretty attuned to it, what it felt like exactly. Um, I could almost describe it as a different type of pain, whereas this pain after the endometriosis surgery was so severe, and the fact that it increased so quickly to the point that I found it difficult to stand up, to sit down, and to eat. It was just, I'd never experienced pain at that level. And so that was pretty easy to distinguish from endometriosis. I did, absolutely. And that was when I decided that I needed to go to A&E. Before the impending doom started, it was other symptoms were things like weakness, just very severe physical weakness, loss of appetite, this fluctuation between feeling warm and then cold, and how quickly those changes happened. Very different from when I've had the flu or a fever before. Um, it felt like it was every minute I was either freezing, and then the next minute I was boiling. And again, just how quickly those physical feelings progressed. And then to the point where psychologically I was feeling disoriented. I was feeling very foggy, forgetful, um, like I was losing myself. The impact has been, mm, I, this might sound strange, but it's been positive. I work an office job, so in terms of the physical effects after hospitalization, they're easy to manage. I also work fully remotely, and I'm really lucky with my workplace that they're incredibly empathetic and flexible. So I can really make my own schedule and take a lot of breaks when I need them. Um, so with work, it's been fine. And I was really excited to return to work after the stint in the hospital and after being at home for, I think I was at home for about a month before I started working again, just to make sure that I was feeling strong enough and mentally prepared. And when I started working again, it felt like such a relief. And I have this new energy and motivation for work because at some point in the hospital, once the amount of procedures and the poking and prodding lessened, as I mentioned before, you're so isolated, but it's also incredibly dull. You're in this sort of non-space, you're out of reality. And returning to work felt like returning back to reality. I would advise those people who are supporting friends or family who have just come home to be patient and also be a bit of a cheerleader for them. It was hard at the beginning to motivate myself, and to have others motivating you helped so much. And I think that while I am still quite weak now, uh, having that right at the start after hospitalization, after being discharged, has helped me gain strength quicker than I thought I would. I Maybe the last thing I would want to emphasize to anyone who has had sepsis and been hospitalized for a long time is to seek mental health support as early as possible. It's easy to fall into this trap of just focusing on physically recovering and getting stronger, but the surgeries, the near death experience, the severity of the disease is, it hangs over you. And it's so important to start to emotionally process that as early as possible.